Okay. So as I told you, normal heart rate 120 to 160 beat per minute. If fetal heart rate less than 120, it is deceleration. If heart rate more than 160, it is acceleration. But our target supposed to be the heart rate in between 120 to 160. So if heart rate is less than 120 per minute, as we call deceleration, there are three types of deceleration: early, late, and variable. Three types or three categories have occurred because of three different underlying causes. Like early deceleration due to the head compression and fetal heart rate reduced before the contraction. And late deceleration, the reason being uteroplacental insufficiencies and decrease the fetal heart rate after the contraction. Difference between early and variable deceleration, combination of early and late, right? And it is called cord compression. So if my patient have early deceleration because of head compression, as a RN, what we should do? Basically nothing except observation. So head compression, sometimes it would be okay because of progression of the labor, but sometimes it is go to bad with the complications. Observation is the priorities. If the deceleration because of the late stage, I mean uteroplacental insufficiency, always prepare to give oxygen, IV fluid, and request mother for lateral position. Also, it is good to disconnect it or discontinue the pitone. Pitone is the oxytocin, what increase the contraction of the labor, contraction of the uterus. Also, be prepared for cesarean section. And last one is a variable deceleration, the reason being cord compression. The first one, head compression. Last one, cord compression. Or it is a combination of early and late. We call it variable. So what are the management? Request mother lateral position like this, or handlebar position. Oxygen be prepared and preparation for C-section. Next, a note here. As I told you, head compression, early deceleration is a head compression. Late deceleration is the uteroplacental insufficiency, and variable deceleration is the cord compression, right? So, easy way to remember: variable, early, accelerate, and late. And here you can write CHOP and VERL, VILCHOP. V for variable, E for early, A for accelerate, and L for late deceleration. In the same parallelly, you should write CHOP, chop, C for cord compression, H for head compression, O for okay, and P stand for placental insufficiency. So variable disclaration underlying cause is a cord compression. And early disclaration, the reason being head compression. And accelerations, is it okay? Increase the heart rate above the baseline. Return to the normal within the 10 minutes. So observation is good. And L stand for late disclaration. Underlying cause is P for placental insufficiency. NCLEX board frequently asking the questions about what are the underlying causes and what are the management. Every student must know about it.